Dr. Ish, how heavy can marijuana play a role in a young person's mental health and brain development?
You know, my heart goes out to Rita because, like she said, she feels like she couldn't save, and we know this could be avoidable, right? Here's the problem that's happening. A young person's brain isn't fully developed until they're 25, right? So any insult between those adolescent and teen years and their young adulthood at 25 can potentially be detrimental, right? And that's the issue that's happening, because we call it your brain is plastic. It's not fully formed, and it doesn't have all those protective barriers that a naturally formed adult brain will have. And so that's why it's so dangerous. And this market that Leslie's talking about, this ain't your parents' weed, right? This is hardcore potent stuff. The clue is in some of the names, Doc. They call it gorilla, the killer, the Hulk, the dragon. Why would you want to put this in, right? That it sounds scary because it is. And the side effects that our kids are having from this are the critical ones, because what you can see is a reduction in what we call executive functioning now, right? These are those things that you're going to need to be a fully functioning adult: emotional control, planning, organization, attention, memory, and regulating your emotions. So it gets right to the heart of your functionality. It's scary stuff.
Have you seen kids in your practice that similar issues as Brian?
Yeah, these are the ones that break my heart. When they come into the hospital, 15, 16, 18-year-old kids, first year of college, what they are typically coming in is what we diagnose as substance-induced mood disorder, which means there's some depression or anxiety. But even more so than that, more frequently than that, it's substance-induced psychosis. They're hearing stuff, they're seeing stuff, they're paranoid, or their thoughts are now so mixed up and disorganized, they can't make sense of it, and neither can we. So it's really, really scary stuff. And the trouble is, some of these kids come in after their first use. One Friday night is all it takes.
With a psychotic episode.
Psychotic episode. Sometimes it can be one single use, and we can never get them back.
Wow. Dr. Ish, are there any factors such as mental health issues that can put a kid more at risk when they use high potent marijuana?
That's a great question. So the things that makes them kids are the things that's also the things that puts them at risk, right? Kids feel invincible as they're supposed to. Kids are impulsive as they're supposed to be. But here's the thing about it. A kid's brain, an adolescent or teenager's brain has more dopamine receptors, right? So whenever I say dopamine, you should think feel-good hormone. Everything that you do that feels good, everywhere you do it, it's because dopamine is driving that train, it's driving that ship. So our kids have more of that. It makes them more impulsive. So the teenager who's more risk-taking, the teenager who's more impulsive also has more dopamine. When you put this high-potency substance in that mix, it sends the dopamine to the next level. So high levels of dopamine feels good. Too high, we're getting psychotic, right? Every single antipsychotic medication that we prescribe has one primary route of action. It decreases the level of dopamine in your brain. So that is the setup. The more impulsive the kid, the higher they are at risk for having a really bad outcome using this Delta 8.